Hey everybody, I bet you're trying to figure out who in the world I am. That's because I'm a new face here at Refuge Medical. I'm one of the new ladies here at Refuge Medical in the store, and you're going to be seeing a lot more of me. So, I'm going to tell you a little bit about myself really quick before we get started in this boo-boo kit. My name's Christina, and I have 20 years worth of medical experience that I try to bring to the table sometimes. So, I am an EMT. I have been to paramedic school. I have an associate's degree in paramedic health science, as well as I have also been a law enforcement officer. You're probably saying, no, that's not correct. But yes, I was a law enforcement officer for 5 years. I was dispatched for Sheriff's Department, Police Department, State Police, and EMS. So, we're going to dive into this little boo-boo kit because I'm a mom of 5. All the mothers out there, you guys need one. If you don't have one, holler at Refuge Medical and we'll get you hooked up. So this little kit here, it is so super awesome, it's efficient, and you need it everywhere that you can put it. This little pack right here, you're gonna open it up and you're gonna pull out this little bandage here. I can get it out here. And what it is, it's an S-Mark bandage. It is comparable to a SWAT tourniquet. It's the same dimensions except maybe just a tad bit shorter. So if you cut your arm or your child cuts your arm, mainly for children, because you cannot use a tourniquet on a child's arm or leg because their appendages are so much smaller, right? So you're going to take this and you're going to wrap it wherever you need to. You're going to tighten it as tight as you can to help stop the bleed. So we're going to wrap that back up and set that there. Then you're going to flip it over and you've got a zipper pouch. We're going to open this zipper up here. And the first thing that I pull out is bandages. That'd probably be a good thing to try and put at the very top. You have several size bandages here. Just little band-aids. You also have a butterfly bandage here for those really difficult places to put a band-aid on. They're good for knuckles. They're good for the tip of the finger. Then we also have here, we have this little package here. It's got a bunch of really cool stuff that you can't just go buy at a pharmacy. So you've got antiseptic wipes. Those are good for anything. You need to clean off a wound or maybe even just sanitize your hands. That works too. You also have iodine pads. I remember my great-grandma pulling out the iodine way back when. If we had a cut or a scrape. You can also substitute that for alcohol prep pads if you want to. You also have sting relief. Not everybody carries sting relief. You get stung by a wasp. Heck, I remember my dad used to put tobacco on my sting. Not everybody wants that on their body. So then you also have triple antibiotic ointment. Get a little scrape, get a little cut, whatever the case may be. That's really good too. You also have burn cream. The burn ointment is really good. I burnt my finger in the oven the other day. Didn't have any burn cream, but it's okay. So the next little thing I'm going to pull out here, this is your compression bandage. I also like to call them the ACE bandage that you get at Walmart. You're going to see them at Walmart. They're wrapped. They're kind of in a roll, but we have them vacuum sealed so that it fits in this little package a little bit better. You're going to pull it out. Say you sprain your ankle when you're out just working out in the yard. You can pull this out. Wrap tightly, but not too tight because you still want to have your pulses in your foot. You're going to wrap it around your ankle to kind of help give it some support. You can also put it around your knee, your elbow. Any joints are really good. Or if you just need to wrap it around your arm just for a little support, that's good too. So the next thing I'm going to pull out is I've got gloves. Everybody needs gloves. You've got 2 packages. So the rule is, it's wet, don't touch it without your gloves. Some people take the little paper wrapping off so that it's already just kind of there and ready so you're not fumbling trying to take that wrapper off when you do need a set of gloves. You have 2 sets. You also have a roll of tape. So say you need to cover a little bleed. It's not too bad for a tourniquet, but it's bad enough that you kind of need to just tape it up, but it's too big for a bandage, right? So you're going to take this next thing that's in here, little 4x4, and you can put that on there and you're just going to tape it up with your tape. Good to go. Brings me to this next little package here. You have 2x2s, 3x2, 3x3s and 4x4s in this little package. Okay, you have a couple different ones. That's really cool. You also have rolled gauze. It's stretched gauze. So if you have a cut on your head and say you need to go get stitches, but it's too big for, let's say, steri strips that are also in here, or it's too big for a bandage, you can take that rolled gauze and you can kind of wrap it around long enough to get to an urgent care, or if you need to go ER, that works. You also have some steri strips in here, so if you get a little cut on your forehead, or you can also use it on your arm, your hand, whatever the case might be, just kind of use that little steri strip to kind of help keep the bleed down a little bit. You also have an ABD pad. ABD pads are really good for larger wounds. Say you accidentally cut yourself, but it's pretty deep. Stick that ABD pad on and then use your tape to kind of help hold that in place. You also have a marker. Markers are really good for anything. Let's say, for instance, you have to use the S-Mark bandage to help control the bleed. You want to use that marker and mark on there the exact time that you put on that S-Mark bandage to help control and stop the bleed, because that helps the EMS professionals learn how long that's actually been on there and how long it can still stay. Then the cool thing I really like is these little splinter outs. They're just little individual sterilized little bitty razor blades. You get a little splinter in your finger or in your wherever the case may be, because we get splinters everywhere. You can take that little blade out, make just a little itty bitty tiny slit, get that splinter out, put a bandage on it. They are all individually wrapped, sterile. So just remember, when you throw them away, be very cautious where you put them, because you don't want to just throw it in the trash and then take out the trash later and holy crap, you've cut yourself again. So just be careful where you put that. There is also, very deep in here, there's also brown duct tape, because duct tape sticks to everything. Use it for whatever you need to use it for. So I really want to let you know where you would keep this boo-boo kit. Keep it in the kitchen. You can keep it in your glove box of your car, in your purse, in your diaper bag. Wherever you think that you might possibly need a bandage or a burn kit, take this with you. These are very docile, and you can take them anywhere that you want to go. Heck, have 5 boo-boo kits so that you have it everywhere. You want to be able to grab it whenever you need it. These are good for teenagers. These are good for even, say, 10-year-olds. They can carry them anywhere. I would just maybe take the razor blades out. So, if you have any more questions about the boo-boo kit, contact Refuge Medical. You have staff here that are ready and waiting to answer your questions.